What do you want readers of this article to take away from it?
It would be good to try to develop systems that encourage continuity of care. I don't want to get away from that. I think knowing people over time gives better care. I think that it will partly reduce burnout for physicians. I think it will decrease the sense of isolation for patients. I think it's an investment. It's like investing in a bank account that generates draw on later when the chips are down. So I'd like to say that I think continuity is important and valuable, and we should develop systems that support that whenever we can. Many situations that's not possible. And the take-home lesson for me, the thing that I took away from doing the research for this article was that just in situations where I don't have continuity of care, that's not an excuse to not invest in the relationship. And that that's a worthwhile investment. I'm going to make better diagnoses. I'm going to advise better treatment for people. And even if I don't continue to have a relationship with this person, maybe the next person will. Maybe they'll be more invested in that idea. In fact, one of the things that I routinely do seeing young children is I start about the age of 2.5. I get down to the level of the young child, and I always start the visit by saying, so how come you're here? And I don't really expect them going to get any useful information from a 2.5-year-old. But by the time they're 3.5 and 4, by the time they're 4, I kind of expect they're going to have at least something to say. By the time they're 5, they'll have something to say, and it will often surprise the parent who thinks they know why they brought their child in. And I do that with children that I know I'm not going to see again. And I figure I'm just setting that expectation with the child. Oh, well, this is this isn't my mother's or my father's visit here, and I'm just here to get care of. This is my visit. I can actually talk to the doctor myself. So I think sometimes investing in those relationships has a paying it forward effect. And I think a lot of times we're commodifying not just our healthcare, but a lot of aspects of society that are increasingly impersonal. So anything we do to make a little investment in the personal, even if we don't see the payoffs ourselves directly, is a good investment in having a more connected society.